then it's also our task to make sure that we point it out to people concerned that we all should be doing better. So I'm Zulfiqar Bhutta. I'm the Professor and Chair in Global Child Health and Policy at the Center for Global Child Health in Toronto. And I'm also the founding director of the Center of Excellence in Women and Child Health at Aga Khan University. My path to getting into public health and global health research wasn't a straight linear path. I got into it because I went back to my home country, Pakistan, after my education and training in 1985 and saw firsthand some of the huge problems that my education and training had not particularly prepared me for. So in some ways, the world was very different in those days. There wasn't anything like global health. There wasn't anything like even newborn health and child survival globally. So one had to learn by hit and trial. So my own capacity development and understanding of the kind of research that I do today has been very much a process of learning and partnership over time. So to answer your question in a nutshell, I got into global health research around newborn and child survival because it was the greatest problem of the day at the time in 1990, and it remains so till today. So my research program, which spans several continents now, with teams in Canada, teams in Pakistan, and people who also work in East Africa, looks at 4 different pillars. So firstly, we have a very strong knowledge synthesis and translation program, which is principally collating all the global evidence around what are the big issues, what are the big gaps, what are the bottlenecks in implementation of a few things, and then to see what we can come up with in terms of synthesis of knowledge for practical action. So we do that through knowledge summaries, through high-profile publications, policy briefs. Then the second part of our work is not just to rely on the theory, is to actually then also look at models for implementation. So a big part of my work is also on trying to discover through implementation research what works and how does it work and how can you make it work better. And that also means that you design studies. Each and every one of those by default is large, takes many years to complete, many years to even write up. But once they're out there, then I think they push the global knowledge several folds because they are actually practical, large-scale effectiveness trials. So that's a second big pillar. The third pillar that I particularly work on is also the pillar of policy and global programs. So I help advise agencies and organizations on how to do things better and what kind of policies would be needed to make a difference in the context of child survival. And lastly, I also spend a lot of my time on evaluation, on accountability. So if things are not working and proceeding the way they should, then it's also our task to make sure that we point it out to people concerned that we all should be doing better. Well, I gave you a few examples today. I think MicroTAS has done probably the largest amount of work with government or public sector health workers on looking at how we can include some innovations in their work that do not necessarily increase their workload, but improve their work. So we work on effectiveness evaluation of how to implement community strategies to reach marginalized and poor populations. We're very proud of that work. Then we have also helped develop, at least theoretically, better packages of care, or better models of care, and some of the innovations that we've been able to put in the newborn sphere relate to studies of doing things like better cord care, better skin care for newborn babies, prevention of infections, and also importantly, how you can work on not only saving babies, but improving their outcomes in other ways. That is, developmental outcomes, how to make them much more wholesome over time. I think the biggest challenge that I face in my research and in any of the questions that I try and ask are the challenges of context. How do you make the best idea work in the worst possible circumstances? So a lot of my work is in conflict settings, in the middle of war, in difficult areas, in my own home country or in other places. And there, the theory does not work. You have to innovate, you have to be agile, and you have to come up with strategies that take into context community perceptions and buy-in. So winning hearts and minds, making communities not subjects of your research, but partners in your research, and ensuring that the fruits of your research also benefit the people who participate in this. That's been not an easy task, but it's also been a huge learning experience for me. So a global misperception of this much cliched term is that innovation equals technology or magic bullets. And yes, there are many innovations which are technology dependent. I mean, M-health, cell phones, e-health is one. But there are far more innovations which are just better ways of doing things. So many of my community work are working with health workers through task shifting and task sharing are also examples of remarkable innovations. Innovations that reduce some of the financial barriers for care and care seeking and improve access for particularly women working in impoverished poor populations. They are also innovations. Some of the best innovations in global health, particularly on maternal child health, are innovations that relate to financial empowerment, microcredit programs, using M-health and e-health to empower women to be able to pay for services which previously they would depend upon a middle person going somewhere else. Those are also innovations that make a lot of, and then of course, management innovations. Doing things in a way and learning so you can improve what you're doing is one of the biggest innovations that technology brings us. So I have to be very careful because you can take a ton of advice and it will mean nothing. So the important thing for any student to start off by is knowing that the eye does not see what the mind does not know. And there is no shortcut to learning. If you're truly interested in global health and some of the big global health challenges, is immerse yourself in at least some of the knowledge and literature that exists. One of the things that I have invested in Toronto is to produce these absolutely free, open access online courses for learning what is global child health, what is global newborn health, what are the issues, what are the challenges in there. And they were particularly designed for people such as yourself and for this question. What would make it easier for people out there to learn something in the shortest possible time rather than to have to go to graduate school or read a big volume of books? So first step is knowing what the issues are. Then, of course, depending upon what you're interested in, your own context, your own geography, your own exposures, picking out areas where you could do a deep dive. And I, particularly for children interested, students interested in global health, I make a recommendation, go and see for yourself. You know, a picture paints 1,000 words. And going and seeing what is happening in many of these geographies of Africa, Asia, Latin America, sometimes even in the urban and migrant poors living in high-income countries, are the best way of finding out what the issues and challenges are. Once you've done that, then the world is yours. You identify areas of interest and follow your heart.